Welcome back, everybody, to Dentistry Beyond the Numbers, the podcast that explains and explores the business of dentistry through the lens of experience, conversations, innovations, and real-world results. I'm your host. I'm your guide, Dr. Marc Liechtung. Today, we're diving into something that makes a lot of dentists uncomfortable. And I've seen that. I've seen that people don't want to talk about this one word, selling. What does selling really mean? And then I see all these companies out there that are experienced experts in raising the percentage of accepted treatment plans. How do they do that? Is it better than what I've taught my dentists? I've always said, what are their buzzwords? What are my buzzwords? I believe in the power of comprehensive treatment. And I believe in the treatment planning is led by dentists who do comprehensive work. The Hamsa, the hand that I really speak highly about because it understands the dentist's mind and the dentists that want to be comprehensive. The other part of it is when you're dealing with the selling aspect, we are not favoring extractions to doing root canals because we do both. If I do a root canal, then I'm going to gravitate to doing a root canal if I don't put implants in. But if I do both, I'm going to do what's best for the patient. And that's going to be the most important thing. I could do the extraction. I could do the root canal. So I just wanted to bring people in that help us move forward. Dentists that I find fascinating. You know, since I started this podcast, a little side note, I didn't realize how many dentists were incredible entrepreneurs or entrepreneurial females. You know, I just never realized that. But, you know, my late father was right. Dentists he was not a dentist, but he saw dentists in the real estate world, and he believed they were more entrepreneurial than physicians. And here today, we're going to see the same. We're going to expound on dentists that are changing the dental community more so than changing the dental practice, their own practice. So there are many people out there helping us, the dental community, get better. Joining me today is someone who's been speaking boldly on the topic of selling, Dr. Ingrid Murra, founder of TwoFront and The Happy Dentist. Amazing, and is a respected voice in the dental startup space. Can't wait to get into this. She's helped shift the mindset around sales in healthcare and dentistry and believes selling is a skill every provider should develop. Dr. Murra is a champion of making high-quality, accessible, prevention-focused care accessible to all. She took her first step towards the goal in 2015 when she accepted a position in Harvard's orthodontics. And what a great program. You know, we don't want to say it, pen people, we believe, we rank higher, but especially these days. But anyway, moving right along, although was specialized in clear aligner therapy in 2019. This is incredible. She made another massive stride. When she went, we spoke about it, she went as a dentist, Harvard-trained orthodontist, could go anywhere. She went to dealing with the dental community education. We're going to talk about how clinical excellence, case acceptance, and more connected than you may think, and how we can all get better helping patients say yes. What a topic. Thank you for joining me, Dr. Ingrid Murra. Welcome.
Marc,
how are you?
Thank you so much for having me. I'm amazing. I'm so happy to be here. Normally I'm in seat, so I appreciate that.
Yeah, exactly. I could see you getting a little nervous. So let's see. You've been really somebody. I got to get this first. I mean, what made you go from, everybody's dream of a Harvard orthodontist? You hang that shingle, and people will generally come to you. But what made you go into something like a TwoFront or the Happy Dentist that we all see all over?
Well, sometimes I tell people, but I started the story by telling people that my first day of practicing was actually, I believe, the worst day of my life until the day that I started practicing. And the reason why is because I had spent 22 years working towards becoming an orthodontist. I decided to become an orthodontist when I was 8. And it was because my orthodontist changed my life, right? We all have a similar story to that. And I got to the chair, like you said, after just being a diligent student like the rest of us dentists, right? 4 years of dental school, 3 years of residency. I did nothing until the day I was 31 besides study, right? And I got there and I realized, first of all, the environment for orthodontists isn't great. I was working 4 different jobs all over the city, groups, private practice, everything. 60% of my patients were retreats, people who had gotten ortho somewhere else recently, were desperately looking to fix their teeth, and said, I keep trying these clear liners. I'm spending thousands of dollars. It's not working. Meanwhile, I went to NYU. All my GP friends are texting me being like, Ingrid, I can't get my patients out of aligners. What do I do? To the point that some of my friends would leave their jobs because they were so embarrassed. So that's when I said, enough is enough. I can't continue working like this. We need a better way.
Clearly, the New York in you is the seller in you. I mean, you've been vocal online. I see your posts. By the way, Ingrid's posts are fantastic. You should catch them. They're very knowledgeable. But it's really saying that selling isn't a dirty word. Where'd you get that mindset? I mean, everybody thinks it's selling, but you feel selling, we shouldn't be shy about it.
I come from a family of physicians. My family is the American dream through and through. They left El Salvador after the Salvadoran War in the late 1970s, came here, became doctors, built the American dream, had 5 girls, put us all through private school. And they're very much physician mindset, which is all about healthcare, right? And I think part of being so healthcare minded is almost being like anti-business minded. A lot of times legitimately so, because we experience and we hear so many bad stories about what business can do to healthcare. I still hear those stories every single day. And when I started practicing, I thought to myself, I'm seeing consults all day, every day. I was closing 3 to 5 patients a day, but my close rate wasn't high enough. I'm an orthodontist, obviously. All my consultations, I'm seeing 8 to 9 consultations a day, and I wasn't closing at a high enough rate considering that people were coming to see me. And I realized after months and months, and eventually after a couple of years, that we need to learn how to sell. Because if we don't know how to sell, then our patients don't get the care they need. What's the point of me having spent my entire life becoming the best orthodontist I can become if I cannot convince my patient why they need treatment by me?
Great point. It's awesome. I got to tell you, when I talk to my docs, my treatment coordinators in the practices that we have, I tell them, look at Lexus. If you look at the car dealership of Lexus, you walk in, trust me, not one salesperson allows you to sit at their desk with you looking at the exit. So everybody that brings our patients off the chair and brings them to the front to talk about a treatment plan, in my opinion, that's part of selling. Selling starts with how you position your patients. Do you put them in a nice glass room that has exit right outside that glass room that says, you know what, I'm exiting? Or do you keep them in the operatory? But you've really taken the idea of, I'm looking at this as comprehensively. So I believe in my practices of comprehensive care. How do you feel? I think this is the biggest aspect of some young dentists not being able to present the whole treatment. For me, the dental hamsa brings in everything. So you're going to mention whatever you need. Clear aligners is number one, understanding occlusion. Do you believe in telling the patient exactly all up front and give them, you're making the diagnosis, the treatment plan? Or does someone like yourself believe in bleeding it in and going slower?
It's a really good question. And the way that I always start these things is I figure out how I'd answer this is, what would I do if the patient in front of me were my sister or my mom? And the truth is, I'd want them to know holistically what's happening in their health. And I think the problem is at NYU, at least where I went, and a lot of the doctors that I work with, we almost operate like ER doctors. We see cavities, we fix them.
Triage.
We see spaces, we fill them. We see gum disease, we fix it. But there's an opportunity to help patients prevent dental work that we all know about and prevent systemic health problems. So, we focus so much on teeth health and gum health, but so much of my passion is helping dentists be comprehensive, which it really involves looking at that occlusion, diagnosing malocclusion, and educating patients on the health repercussions of not fixing that malocclusion.
Right. I got to tell you that when you come an NYU, a Bostonian, I know you've traveled many areas of the world. For those of you that don't know, Ingrid has got a life that I envy. Last time I spoke to her, or the time before, she was in London. So she gets around, and then Spain, and then there, but there. But the question I have is this: in an area like New York, I always believed that if we're not comprehensive, it's sort of like carving a nice temp. I always believed that a patient could walk down the hall, the block, the avenue, and get a second opinion. And if they walk in and say, "Didn't the doctor tell you about the infected teeth?" No, we wanted a whole back. That doctor will say, "You have infections up here. You have broken teeth or decay that we're holding back." I agree with you 100%. I think the doctors that say selling is a bad thing are also the doctors that don't feel confident enough to give the patient exactly what they're coming in and paying for, a comprehensive treatment plan.
Yeah,
Right?
I think
I
you
mean,
nailed it. I think you nailed it when you said they don't have confidence enough, because I think the reality is it comes from fear. And I know that because that used to be me. That used to be me where I would fear what would happen. How would my patient react? I didn't understand business. And I think that the problem with fear is it comes from lack of knowing or lack of confidence. And I think that's what's so critical and it's missing. And I'm with you. I think that we're kind of living in this world of like, oh yeah, you're going to go to my periodontist, go to whatever. But like they don't want that. The trust is with you. So the more in-house services you can offer, the more one-stop shops, that's how you're going to compete with the tens of the world. I say tens because
so
you're in New
you
York
are going to
City.
dive into that great concept of that. And that's why we're on. And I got to tell you, I love talking to Dr. Murra because it's amazing. You got such a grasp of our profession at such a early stage in your career. It's lights out, and it's great stuff to have people educating the doctors that are coming up. And I think it's phenomenal. But I do believe in what you just said. I also feel that, my concept, which was taught to me by associates through the years, wanting to do more, you know, drill, bill, and fill. I mean, or drill, fill, or drill, fill, and bill. I like to bill and then fill. But, if that's if that's our mantra, then we're boring. I think the beauty of dentistry is what you're talking about. I mean, you know, I don't like referring out of my practice. So we used to have these high powered specialists come in and demand this, demand that, demand this. And now you're saying for orthodontics, let's stick with that. You could deliver the cases that we've always wanted to deliver. Is that correct?
That is correct, with one caveat. I strongly believe, and we'll get into this, an orthodontist designed, GP delivered ortho. And I believe that's the model of the future. And I believe that in the next 5 to 10 years, it's going to be the only way that we do ortho.
So talk to us. We are going to get into that, but I don't want to go in there yet. I do want to stay about the concept of when I speak about the ability to do clear aligners, root canal therapy, crown and bridge cosmetics, surgical extraction and bone grafting, and then implants. Somebody may say, and they may say, what about a specialist? Wouldn't they do it better? If I go to an orthodontist, wouldn't they move my teeth better? If I go, and this is to your point, so I'm going to let you expound on that. I mean, really, that's before we get into the money and the this and the that. What do you say to people like that? I mean, shouldn't I go to a surgeon for an implant, an orthodontist for ortho? So just curious.
So the only thing that I can speak about well is the specialty that I know, which is ortho. And I know so deeply from, our network of orthodontists, we've treated tens of thousands of cases. And I know from my own experience as a practicing clinician that if to try to learn ClinChecks on your own is, we always talk about money, right? And growth. But the way that I see it, there's three currencies in life. There's time, there's money, and there's emotions. And the issue with trying to learn everything yourself is that you're not having time for other things. And I believe super strongly that GPs, all dentists, right? They need time to learn the business. You and I spoke about this before. Without knowing the business, that's where fear comes from. And so, in my opinion, you should, if you're going to do something, do it really, really well and offer the rest in-house. But it doesn't necessarily have to be you. Steve Jobs didn't build the iPhone on his own. And there's ways to capitalize on that by building a business and having those referrals here and creating a system where you keep it all in-house.
Okay. I think that's unbelievable because that's the way I lived. That's the way I practiced. I kept things in the house. And eventually, I had the specialties. So it wasn't me doing the implants or the root canals, but later on, it was doctors like me, like you, young male, female, coming in with great training, saying, "Doc, I want to." And for me, it was about keeping those good doctors, because if I said no to them, if I said no to a young Dr. Murra, she would say, "I want to do clear aligners." Now, you're a trained orthodontist, and we're going to get into that difference, but you believe, even as a trained orthodontist, there are most cases that can be done in the GP, no referral out.
Yes, 100%.
What happens? How does a practice in your mind that's listening out there and says, "Well, I just can't just flip on the switch"? Like, is something what you do guide them? Like, I believe in, here I am doing crowns and fillings and onlays. I'm going to bring in a young associate that does what I call procedural matching, things that I don't do. How does one flip that switch, or the gearing their practice towards that move of receiving orthodontic patients and from there much more procedures that they're looking to do?
Okay, so it's a really good question. And I think as a GP, because obviously I am a GP first, I think the first thing I would do is actually, have you heard of Ikigai?
Hmm.
I'd figure out, what do I love doing? What do not what's going to make me money. What do I love doing with my own two hands, first and foremost, instead of the money? And really hone in on that. Like, really get good at it. And maybe you pick one, two, three things. And the rest of it, find the smartest people around you, like you're saying with your associates, bring them in and build a business where you can keep it all in-house. Now, I'm talking about everything besides ortho, because we have a better solution for how to keep ortho in-house without having to have that specialist physically in your practice. But everything else, and like, if I were not an orthodontist and if I weren't building TwoFront, that's what I would do. I'd be like, who is the smartest oral surgeon, the best, and not only just smartest, best clinical skills and best communicator that is going to communicate from a place of empathy and really get people to understand why they need treatment now, and why they need treatment by you.
Great. I think you touch on a word, and you said it a few times: communication. I think the more communicative our team is, the better we will see cases being accepted. I think communication, and we have spoken about this, starts early, and it needs to just transcend the practice. We need to be polite. We are having patients. These are the people that pay our bills, and they're very important. Let me ask you a question before we let time run away, because I know we're limited. And this is fabulous topics. I mean, what do you feel about doctors that are sitting there and talking about money? They don't trust Sally. I don't like Sally talking money. I talk money. How do you feel about that?
So to be honest, I think it's actually to each their own. What I do know is that when that's when people put up objections, right? Oh, I can't afford it. I can't afford it. I think the truth is that if people say that, there's a good chance that they genuinely can't afford it. But nowadays, with today's third-party payment plans, you either need to get those third-party payment plans that get them the monthly payment plans that they need, and raise your prices if you need to, so that it becomes profitable for you, or realize that you haven't shown the patient enough value. I think it's as simple as that, because you see girls all over flying to Korea, getting $40,000 of procedures who make, $40,000 a year, because they see the value. So if you can share the value and really communicate that, people are going to make it work and they're going to finance it.
That's a very good point. I mean, honestly, it starts at the chair, and I'm a very big proponent of doctors being doctors and having treatment coordinators that can go in there and listen. I just want to speak to the listeners out there. I think you make some unbelievable points, but many patients still need a sample, a look. What is it? What is a veneer? What exactly is a cap? What do implants go into, the gum or the bone? I mean, we don't need to be the gore, but we need to be. And from the doctor's chair, the doctors, we speak about this again, not too gory, not too deep, 20,000 miles above, explaining how it will take time, but really focus on the result. Really focus on the teeth will be straight, the gums will be healthy, your smile will be great. We can bleach and continue to keep it white. So I do think those are the most important points. I do also think I have to agree with you because, to each his own. Are there any language that you could leave us with? A little tip about language, maybe not to say X, but to say Y, and feel about communication is so important. Like never say blood.
Yeah. Okay. So just, I guess going back to your question about money,
Right.
if a patient asks you, because they will,
That's
they're
right.
going to ask you, how much is it going to be? And I'll just give you a short story, which is that I had a cat who, had cancer and it was spreading. And of course, I was freaking out when I was in my vet at Modern Animal. And I asked her, how much is this going to be? Right. I'm like, oh my God, here I am with like my car payment and all these things. And she handled it so gracefully. And she was like, I'm actually not sure, but what I know is that we have some of the best payment plans and we can make this work for you. And Heather at the front, she's our expert in all of our payment plan providers, and she's going to run you through and figure out something that works for you and your budget. And so I think my point with that is not actually denying it, like not outright denying it, because that can make the patient feel bad, but being like, I'm not totally sure, because the truth is there's probably some, depending on what payment plan the patient chooses, right? There's going to be some variance. And so it's better if you let the treatment coordinator just handle it and gently let them know that they're in great hands.
I so agree with that. And I'm thinking about it. And I used to cavalierly say, I would say, not used to, but I would say to a patient, that's way above my pay grade. But I'm making light of a very important, but what you just said is there's a lot of intricacies, insurance and different formats. It's just not what I'm best at. And we're going to let, Mendy come in and talk to you about it. But I will say, I do also think of this. I think patients are testing us. And now this is the New York skeptic in me, and I've been dealing with a lot of New Yorkers all my life. But the fact is that when a patient asks us, do they ask their heart surgeon how much it's going to be? I never asked my orthopedist, how much is that meniscus going to be? I just said, okay. And I think patients may be testing with these bigger cases now. Well, doc, how much is that? That's $23,652. I don't want a doctor that rattles off a price tag. I mean, how do you feel about that? Right? I mean, Mary is just testing us. Really, when we say treatment coordinator, we pass the test.
Exactly. 100%. I couldn't agree with you more. It's you don't want to be that person that's like you're both delivering the healthcare and you're delivering the price. If my cat's doctor would have been like, it's $4,999, I would have been like, screw this woman. She just wants my money, right?
It's as if the next step is she takes out a credit card machine and just says, put the chip in. I mean, that's what we're going to do.
Right.
It's crazy.
The truth is we don't want that person that's doing our care. It's sensitive. We don't want them handling the money too.
Exactly. Exactly. I think that's a great point. We don't want them handling the money. So people out there need to understand that doctors are doctors. And the more we divide and conquer, have the confidence in that treatment coordinator. There are doctors that think their way is the best way, but their way shouldn't be with them in it. Could be their way, but let somebody else. Let's move on. Great. I mean, you're just a wealth of knowledge, and I really want to get people to hear all that you can help us with. I mean, what do you think of the situation with helping clear aligner cases come into a practice? I think that is what I want you to handhold some of these practices, because when I acquire a practice, one of the best things we do, and one of the first things we do, is ask, do you do Invisalign or do you clear aligners? But, I'd be remiss in asking you, there are companies out there that are implementing orthodontists. So, I mean, you're an orthodontist being implemented to understand it. So I'm not, as sort of like the buffer between the dental practice and Invisalign. Am I right about that?
It's a really good way to put it.
Okay. So it take me from start to finish, because I don't want to miss out on discussing this. It's important to me to understand how, with what I've read, a percentage of upwards of 72 to 75% of refinement in these areas. How do I know I got to get certified, so I get certified, but how do I know how to do it? How do I know how to close it? Go ahead.
So many great questions. I'm going to start by answering your refinement question. Refinements, it's this industry for 25 years has now focused on one thing, and one thing only, which is getting CE and getting good at Invisalign. After going through, I got lucky, and at my residency, we basically only treatment planned using clear aligners. And then I went to New York City and I practiced only using clear aligners. And here's what I learned. In order for those clear aligners to work, you have to be an expert in treatment planning, because if you just miss one button, or it's too high, or it's too low, or it's the wrong shape, guess what? That will lead to a refinement. And if that expert is using software that is not extremely sophisticated to be able to torque, to expand, to distalize, to rotate, to have anchorage, right? All those biomechanical principles, what's going to happen is no matter how good you are, it's not going to work. So the core to keeping aligners profitable at your practice and making your patients happy and making those aligners work comes down to two things, which is using the best software, which is Invisalign. We use Invisalign. We pay for Invisalign. It's the most expensive one in the industry. We pay for it because we're going to get our patients the fastest results, the best results, with the fewest refinements and the shortest amount of time. And we pair practices with the top clear aligner orthodontist in the country. Because the truth is that we say no to 9.9 out of 10 orthodontists who apply to TwoFront, because most orthodontists are not trained in clear aligner biomechanics. And it's a pretty fundamentally different specialty.
Can GPs, when you go, and I'm sure you're going to be looking at a continuing education program, is there any way GPs could learn those biomechanics? I mean, I really see one thing I notice is there are certain doctors, and for some reason, predominantly female, that I find in my experience that love orthodontics. They do the fast braces, they do to get a feel of the clasps or the brackets, and then they do Invisalign to get a feel of clear aligners or other companies. There are other companies out there. But what I'm saying is those type of clinicians yearn for more and more. Would they be ever, some of them are pretty good, so maybe for those biomechanic courses and really becoming, like you said, understanding the concept of where to put the bonding bracket and all the buttons and all that.
You could. Anyone could learn anything, right? But I go back to why. If it's going to be your specialty and if it's going to be something you do all the time, even me as someone who became a clear aligner specialist, what I realized is that I couldn't build the clear aligner empire that I wanted to in New York City because there was two other things missing. And there's three parts to doing clear aligners extremely well, which is that you have a high close rate. You do those clean checks extremely well so that you limit your refinements. And part three is you have a system to make sure that patients actually wear those aligners. And even as someone who is a specialist, my close rate was less than 50% because people see aligners as a commodity. What we are fighting as an industry, I think we've got to get our desire for clinical skill sets out of this, because the truth is that our patients see aligners as a commodity. So the more you invest, like, listen, I spent hundreds of thousands of dollars to become a clear aligner specialist, right? But patients don't care. They're thinking they're being targeted by 300 to 400 millions of dollars of marketing by Invisalign a year. And they think an Invisalign doctor is an Invisalign doctor. So if you're going to try to sell, you're going to have to lower your prices, is what most people do high volume, deal with the refinements, figure out systems. And now you're in an aligner mill where you're doing checkups and emergencies and scans all day, every day, the more aligners you do. So the short answer is you could do it, but there's a better way. It's like trying to 3D print and manufacture your aligners all day. Why do it if you can make more money, treat more patients, work less, and do more, right? That's my philosophy.
And deliver great care.
Exactly.
Wow. So what we do is that's great. So, well, blah, 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 blah. You got me speechless. I mean, it is probably a better way. I hate to say it, but unbeknownst to me, I asked the question that fell into it because some people go take, like you say, thousands of dollars of continuing ed. But what you could do is literally talk to an orthodontist and learn through every single case, because it's not like you're just doing it and then sending it back. You're having a clinical discussion, correct? So if there's a
Exactly.
crossbite, if there's a deep overbite, if there's some real mesial tilting or distal tilting, we'll discuss it. Maybe it's better extracting that tooth. Super eruption. So these are cases that might be a little bit, as you get more and more on and more along the line of doing clear aligners, that's an avenue to really expand our knowledge, is just by doing cases with somebody like yourself at TwoFront.
Exactly. Because listen, as healthcare providers, like our goal, all of us, we're in this for a reason. We want to give value to our patients. We want to make our patients healthy. And there's a lot of ways that we can make our patients healthy. So if you have the ability to give all these services, to your point, in a one-stop shop, because guess what? You can refer to your local orthodontist, but the average wait time for an orthodontic consultation is 28 days. And the average close rate, guess what Heartland Dental's close rate is on a scan? Scan to presentation. Guess what their close rate is?
42%.
Love that guess. 0.7%. Closing aligners is the number one issue in the industry that we don't think about as clinicians.
It's an amazing number.
We think about clinical. It's almost egotistical, right? We think about, can we do it? Can we do it? But closing is the biggest issue.
That's amazing. They go up 2 points, 2 percentage points. I have a question. Do you think it's going to come down like the Beta or the VHS did years ago? I mean, 65, 85, we hear numbers all over the country for the clear aligners, but really it costs them a couple of bucks to make. Is there a time when we're going to do clear aligners for under $4 and be accepting by more people and being financed easier? I mean, let's face it, the barrier is money. So would you think that would happen in the future? I mean, there's a lot of competition.
So I'll tell you what.
Along those lines, what happens? Should we look for an inferior aligner? I mean, everyone's talking about the plastics, right? The thickness, the movement, the comfort. Just curious about that.
I'll tell you what. If there is an aligner that will give us great results in a shorter amount of time, if we can get, the whole reason we use Invisalign, right, is for the results and the time, because you can get good results. Our orthodontists can get good results with cheaper aligners, but it's going to take more time, which makes it less profitable, right? You need to be able to do it so that your profitability per chair time hour is less, so that you have, clinicians have, what is it? It's like, I think it's like 420 hours. I could totally be botching this, right? But a certain amount of hours in a year. And if you're spending, the average clinician spends 10 to 20 hours per aligner case. And if you're doing that per aligner case with a cheaper aligner, it's not the best use of your time. And so if someone's going to come up with an aligner that's able to give us the best results in a short amount of time, TwoFront's going to be the first person to do it, because our shareholders, they want us to make more money per case. So of course, we're going to switch first thing.
And I will say that, Dr. Murra, congratulations. I know your whole empire is growing, and for the right reason. You have really been out there, and it's incredible and enlightening and refreshing to see people understand that the quality of dentistry and lowering now we have partners that will help us, lower the rate of failures and increase our rate. Before I let you go, what should it look like? What does a clear aligner success story? 0.07 is disgusting. No offense to anybody. I mean, they've got their own, but that would be putting us out of business as a private practice owner. What do you think it looks like? Give me a percentage, and then give me refinement percentage. How many cases, if it's now at 72%, I've heard, where could we get it to? And where could it go with TwoFront, holding our hand, literally helping us get through these cases where we can handle more cases?
It's a really good question. So if you're properly diagnosing all the patients in your practice on a daily basis who can benefit, let's call it 10 to 15 patients whose bite is going to cause future dental work down the line, and you're diagnosing them and you're referring them in-house with TwoFront, you can expect at least a 20 to 25% close rate, which is a lot of patients over time. And that's just in month one. A lot of those patients need time, right? They need time to think about it. So a lot of those patients, as long as you're properly diagnosing, you're going to get closed in the next 6 months to a year, maybe a year and a half. And now you're closing 30-40% of those patients by referring them in-house and properly educating them through your ortho team on the benefits of their specific malocclusion. That's how TwoFront serves as your ortho partner. In terms of refinement rate, because we only partner dentists with the top orthodontists in the country, our class 1 cases have almost zero refinements. However, we also treat class 2s, class 3s, open bites, deep bites. We even do lower incisor extraction cases. So typically for those cases, you're going to have about 1 refinement.
Well, talk to the team about that. That's awesome. I know we're on a tight TwoFront schedule, but is that done virtually? I mean, will they then have the patient talk to you virtually in an operatory explaining the movements and everything? And that's how they're accepted, and with the doctor coming in or staying out, it doesn't matter.
Great question.
Yeah.
Educating patients takes time, especially when you're educating them on why they need that implant, why they need that crown. You don't have time in the chair. And so what we do is we give you a referral form where they schedule themselves for a virtual consultation with TwoFront. And you just say, I'm going to get you set up with a call with my ortho team. They're going to review the ortho part of your treatment plan. We're going to talk about the dental part of your treatment plan here. If you decided to move forward, I'll see you back here with your aligners. I'm going to coordinate with my orthodontist. We'll get you all the aligners at your next appointment, and my ortho team will take care of you from there.
That's awesome. It's almost like teledoc.
Exactly.
Wow.
For dentists.
And I think it's a great learning tool. That's amazing. I like that. I will say that Dentistry Beyond the Numbers really tries not to do anything but keep it real and keep it educated. And this is, sometimes I myself ask questions that I'm interested, that I know if I'm interested, other dentists, I've been through a lot. I've had a lot of experience, some people say. And if I'm asking it, so to understand that, it's not like you're bringing an orthodontist into the practice. It's all done virtually with explaining, with the everything that we would use in office as diagnostic tools, correct? So you would show the movement, gum disease, this, that, whatever needs to be addressed.
Exactly. You are the experience vehicle. You own the relationship with the patient. And the cherry on top is that we are an ortho group, not a lab. And so we take on the liability. So you feel comfortable treating everything in-house, because guess what? We put the protocol. That's why we say no to 9.9 out of 10 orthodontists, because we're going to guarantee those results.
Any difference in cost per case for the different level of orthodontists we're seeing?
Slightly.
Like if I'm going to see a Dr. Ingrid Murra, I mean, that's going to break the bank. We're going to have to back up the truck to see Dr. Murra's treatment plans.
It's a great call. So one thing I'll tell your listeners is that you're able to give orthodontist quality, and not only orthodontist quality, top clear aligner orthodontist quality treatment from your practice for less than the price of what most GPs are offering. Because of course, we're streamlining the costs. We get lower cost in Invisalign. We get lower cost on our financing rates. We get lower cost on everything. So we streamline those costs so that you can help as many patients as possible, while at least quadrupling your per profit chair time hour when you're delivering a case, so you can feel good about it as a business decision.
All right. I threw the clock out. I want to ask you a question. A group has 10, 15 practices. We're doing great. We look at our clear liners. We're involved with Invisalign. You're saying that if I ask you to work with our team, and TwoFront works with our team, we could get our Invisalign numbers and our clear aligners in general more efficient, because you're going to start going into you're involved with DSOs and groups, and this is how you increase, obviously, our revenue and hourly production and all the good things that come with it. It's phenomenal.
We don't make money unless you make money. I used to fear business, and now I love it because I realize that it can be used for good. And we don't make money unless you make money. We are your partner in ortho. We're going to help you grow those cases. And I'll give you a stat, which is that if you're scanning and referring 5 patients a day, you're going to start at least 1 Invisalign case a day. So across 15 practices, you can do the math there.
It's unbelievable. I got to say, this has been incredibly enlightening, incredibly educational, and phenomenal discussions with you. I think we can keep going, as we know we have a lot in common to discuss, but TwoFront sounds wonderful. It sounds like a situation we all have to look into. But for those of you that are looking to bring clear aligners, especially Invisalign, into your practices, if you're starting or you've been in business for 30 years, why not? It's amazing. I see associates changing lives through clear aligners on cases that patients never thought. And now we have people that are going to make it less expensive, more educational, and a better outcome. What a great, great idea. Thank you so much, Dr. Murra. Ingrid, it's been a pleasure getting to know you a little bit and speaking to you for as long as we have, and I hope to keep it up. Thank you so much for being involved and joining us here today on educating our doctors in dentistry beyond the numbers. Thank you.